Professional firefighters are getting in shape. It's no secret that a strenuous job like this demands top levels of physical performance. With increased access to training equipment and given the time to use it, firefighters can get fit faster and stay that way longer. Every day, wellness fitness coordinators and IAFF, IAFC peer fitness trainers are coaching firefighters how to exercise effectively. In addition, once a year, peer fitness trainers may be enlisted to assess all firefighters to measure their current level of fitness.
The importance for an individual to participate in a wellness fitness program from one year to the next, I think, lies in their being able to do a quick self-check, even if it's just once a year.
The components of the Wellness Fitness Initiative involve doing cardiovascular fitness assessments, assessments of muscle strength, muscle endurance, and flexibility. And all of those are aimed to try to improve the health and wellness of firefighters, as well as reduce the chance of injury and possibly lessen the severity of an injury if something happens.
It's, in effect, a series of snapshots that by the end of their career turns into a moving picture. And they have control over the way that picture ends, given the knowledge and the power and the resources to do something to change what inevitably happens to most of us as we get older.
To measure a firefighter's fitness objectively, the annual assessment tests body composition as well as physical capacity in the areas of aerobic fitness, muscular strength, muscular endurance, and flexibility. For each of these capacities, firefighters will clearly see how they are progressing each year, and they can be confident that the information collected will remain confidential.
I think the point is to get a baseline of information on the firefighter, to give you some direction as far as where you want to take that firefighter with an exercise program. It helps you set some goals for them, some short-term and some long-term goals.
Before getting started, you need to be prepared. Make sure to have the required equipment, measuring devices, and data forms necessary for each test. Make sure that the firefighter has had a health screening and that he or she is wearing proper exercise attire. Next, collect the following information about the firefighter: the firefighter's resting heart rate and blood pressure, age, weight, height, and gender. It is also helpful at this time to calculate the firefighter's body mass index, the formula for which you can find in Appendix A, Table 5.3. You will need this figure later on. Be sure to explain the purpose of each assessment and describe the protocol thoroughly before starting each test.
To get ready to give a fitness evaluation, I just want to make sure that I cover all the bases, that I get the confidence of the person that I'm giving the evaluation to. I want to make sure that we can go through this and it's not stressful for them, so that it's just a information gathering process.
The first evaluation is body composition, an important indicator of physical fitness. The body composition test measures the ratio of the firefighter's lean mass to his or her body fat. With the subject standing up straight, locate the 3 gender-specific skin fold sites to be measured, all on the right side of the subject's body. Mark them with the water-soluble marker. For men, you will measure at the triceps, subscapular, and pectoral sites. For women, you will measure at the triceps, abdominal, and suprailiac sites. For each measurement, place the calipers on the skin 1 centimeter away from your thumb and finger, perpendicular to the skin fold, and halfway between the crest and the base of the fold. Wait 1 or 2 seconds before taking the caliper reading and maintain the pinch while doing so. After completing a measurement at each of the 3 sites,